Fantastic. So this is a great case of a 42-year-old female who comes in post-ankle sprain. This has happened 1 month ago. So just looking at the axial images on this fluid-sensitive sequence and sagittal images, we can get the sense of the degree of effusion and going in to evaluate the ligaments now. So while we start up high up along the syndesmosis, we begin to see that the layers of the anterior-inferior syndesmosis actually have some type of edema between them, but they're still intact and I can still see them in this way, and I can see the lowermost fibers. Moving past that region, now we get to the region of the anterior talofibular ligament, and notice I have an irregular ligament, the fibular attachment also slightly more frayed, and when we look at this under also T1, we can see the irregular changes along the bone, the early pull along the bone, the stress-related change. So just bring it back up to our axial images, we can see that I would call this a sprain/partial tear because it has laxity to it, and that's the rest of the ATFL. And then we can look at those fibers of the PTFL we see, and the calcaneofibular ligament here. Part of it is here, there's periligaments edema, and there's sprain and irregularity as it attaches to the inner aspect of the distal fibula. And we can also see on the coronal imaging, we can see the region of the ATFL and the sprain that's occurring more on the fibular side and the actual edema at the lower tip. We can also see the calcaneofibular ligament seen deep to the peroneal tendons as this band here, this structure that's actually attaching from this region. And we can see that sprain and periligaments edema in this thickened ligament.